So let me tell you a little bit about Geoffrey Smith. Geoffrey leverages a diverse 25 plus year career in human capital management, specializing in employee engagement, leadership development, and culture change initiatives in the workplace. His journey has ranged from working for the corporate industry leader to building his own entrepreneurial startup from the ground up. Currently, he supports innovative employee, patient, caregiver, human experience leaders, nurse and clinician entrepreneurs, and hospital administration, consulting them on modernized people and talent activation strategies to make a true impact on those that both provide and receive. Tell us more, Geoffrey.
Yeah, so my background, as you mentioned, is in kind of the workforce side of things, the employee experience. Um, as you mentioned, I've done everything from work for the corporate industry leader to building my own entrepreneurial startup, where I was actually fortunate enough to have a real life Shark Tank with Mark Cuban, well before there was a television show. Um, I've also helped other entrepreneurs launch new products to market, helping them with everything from sales and marketing to product management, deployment and implementation, customer success and retention, helping purposeful entrepreneurs in healthcare and beyond take wonderful products to market. More recently, up until about 2 years ago, I was supporting enterprise level hospital systems across every aspect of the employee life cycle. I always like to say employee engagement in many industries can often just be kind of a buzzword, but in healthcare, they're a necessity for optimal patient outcomes. And it wasn't really until my personal and professional lives collided that I truly understood the importance of my own work during my wife's battle with cancer. I saw firsthand her hang on every word and instruction of the nurse that made her laugh and coincidentally tune out the clinician that had his head buried in his EHR and wouldn't make eye contact. So I really started doing my own non-scientific study in looking at my own business of employee engagement in healthcare through the patient's eyes. And everything kind of came to a head in my purpose. One day where I was doing the part of my job I loved, I was doing an all-day workshop around employee engagement and leadership development to a 25,000 plus employee health system here in my backyard in Connecticut, one of the greatest academic health systems in the world. And we were bringing in different parts of the organization throughout the day, OD and LD for 90 minutes, nurse leadership for 90 minutes, C-level. And we got halfway through the workshop and broke for lunch. And coincidentally, both fortunately and unfortunately, my wife was 800 yards away from the CHRO's boardroom getting prepped for a bone marrow transplant. And when we broke for lunch, I walked across the street. I walked into my wife's room. Her nurse had her arm around her, and my wife was crying. And I ran over and I just said, "Why are you crying?" And she said, "Because Gloria didn't bring me my lunch today. Gloria sings to me when she brings me my lunch." And it was just a very powerful moment because here I am with bullet points and whiteboards and PowerPoints talking to the CEO of a 27,000 employee health system about how employee engagement impacts patient outcomes. And a food service employee is impacting my wife's mood as she fights for her life. And I went back to the next session and we got going again. There were actually a couple of detractors from the health system saying, "Oh, I see how we can do some of this stuff with our nurses, but I'm not sure how we scale it across the organization." And I just raised my hand. I said, "Hey, could I tell everyone a story? It's about 45 minutes old." And the tenor of the meeting changed. It changed from whiteboards and PowerPoints to true human connection and how every touch point at a healthcare system can impact and create either extraordinary human experience or not so great experience. And I left that day after talking to the CEO that I never felt like I made a bigger impact in my career than that one day, than being able to impact those that both provide and receive care all in one fell swoop because employee experience is patient experience. And it brought me down a path of realizing there was something more for me. Because when I got to my car that night, I picked up my cell phone and there was a message from another health system in New Hampshire around a commoditized payroll issue and some tax compliance issue. And I just went from this huge high of impacting people's lives to something completely administrative. And it brought me to down a path of saying, okay, how much of my job do I truly believe I impact those that both provide and receive care? And how much of my time am I wasting with administrative stuff? And I came to the conclusion shortly thereafter that it wasn't enough. And I was going to resign from my cushy corporate high paying job and jump without a net and just figure it out where I can make a bigger impact on this world through my background and experiences. And yeah, it was, I believe uncertainty can be empowering. I've never found anything bigger in my life without walking through a phase of uncertainty first. And so I started down the path of just collaborating with, meeting, introducing myself. One of my first connections was Denise Wiseman, and she connected me to two wonderful people that connected me to three other wonderful people. And for the last 2 years, I've been collaborating with world's leaders in child and frontline well-being and mental health, nurse and clinician burnout, caregiver engagement, patient experience, working on wonderful projects with a loving organization and HRC. Had the privilege to support nurse, clinician, and just healthcare innovative entrepreneurs about help taking their wonderful products for the front lines, by the front lines, and get them in front of healthcare administration, get these products that can solve problems for nurses, doctors, patients, help take wonderful ideas and turn them into businesses, because we all know how hard this is in healthcare. I also have the privilege of evangelizing directly to healthcare administration and teaching a modernized version of employee experience and employee engagement and a modernized measurement. Too often, I like to say healthcare is at the forefront of clinical innovation, yet lags 30 years behind the private sector and people strategy for some reason. So helping create aha moments with healthcare about teaching a different way. It's not a once a year event or a survey. Engagement is a real time, living, breathing organism that can change shift to shift, patient to patient, team leader to team leader, and educating healthcare systems around how to, in a modern sense, get their arms around the most critical workforce on the planet. So the last 2 years has been pretty meaningful, impactful, purposeful, cathartic, rejuvenating. Um, Last summer, I was approached after someone heard me on a podcast, on someone else's podcast, approached me about hosting my own podcast, which is really highlighting some of the true innovators in employee experience, which is my work, patient experience, and caregiver experience, which I'm sure is a lot of the work of the people listening right now, and just plain human experience, which is all of our work. Highlighting kind of the moments that connected, that shaped us, moved us, inspired us to pursue purposeful outcomes in our lives and in the world of healthcare. Denise has been a wonderful guest on my podcast and other members of HRC as well. So what I can offer the group, um, I book a good portion of my week. Every week, I put aside time for pro bono consulting and donating my time to any healthcare entrepreneur that is trying to, in a very difficult industry to break through, figure out how to get their meaningful, purposeful, impactful products to market. And I help them with everything from product launch to company launch to strategy to how do we present this to healthcare administration, which many times there's a huge disconnect between our frontline caregivers and healthcare administration. So that fills my cup, and I love. So if anyone listening, watching the recording, or here today is trying to get a healthcare project off the ground, please reach out to me. My entrepreneurial background and my understanding of healthcare administration and how decisions get made for products in healthcare, maybe can be of help. So that's really what, I could help you, but you also help me, because working with all these purposeful entrepreneurs that are trying to reinvent and make an impact in healthcare, I donate my time because it means the world to me. And it is just, I love what I do every day. What I need, I would say, introductions to any purposeful innovators that are impacting those that both provide and receive care. Oddly enough, I'm still trying to figure out, I'm in no hurry, but I'm still trying to figure out where I can make the biggest impact, and still, for a couple different reasons, still searching for a full-time home, even though I love what I do. I've learned, especially in meetings like this and collaborating with people, I do, being out on my own, miss being part of a innovative and purposeful team. And I've also learned recently that the industry I strive to serve is not exactly all that kind to solopreneurs from the perspective of healthcare benefits. So I am, I would like, as leaving the corporate world, I didn't realize that the access to great care that I had when working for a company that was recognized as a company, even though I have my LLC. Unfortunately, the government and the ACA doesn't recognize one employee companies as companies. So kind of, still looking to be part of a team and somewhere where I can get the benefits to make sure I continue to take care of my wife after her battle with cancer. And lastly, what you can do for me, I would love feedback and I would love people to listen to my podcast. And if you enjoy it, I mean, it is stories of inspiration, stories of there's so much negativity in healthcare. To hear the positive innovators and to hear their stories of their connection or reconnection to purpose after burnout or whatever. I had the CEO of the largest hospital system in New York City tell chilling stories of leading on the front lines during COVID. But then those chilling stories turning to positive outcomes and wonderful, amazing just like Mike, the story of beating cancer, is a constant theme in the podcast. But if you enjoy it and it does strike a chord, please help me with the amplification, comment, subscribe, repost, and shine a light on the inspiring guests that I bring on. It has absolutely taken off. In the amount of time they said it would take 3 years to get 15,000 downloads, I have gotten in 10 episodes. And it has been a wonderful journey and take out listens and downloads and all of that stuff. That's great. And my podcast network loves it and they're happy. But what I'm happy is when I get messages from people whose the inspiring stories told by my guests and myself resonate with them to the point where they don't feel alone in their battle or they learn something that they can apply to their own life to act in a more purposeful manner day to day. So that's it.
Thank you, Jeff. That was great to hear you just jumping into the uncertainty and enjoying the ride for sure.